Good afternoon, Mr. Rowe. My name is JD Lopp. I'm a student physical therapist here at the University of St. Augustine. So I understand we've been having some pain and some swelling in that elbow region. So I had a treatment in mind that I wanted to try out today, but before we go ahead and do that, would it be okay if we tested a couple things, just looking at your skin and then sensation, just to make sure you're appropriate for treatment? Great. So the first thing we want to do is assess the skin integrity. She does not appear to have any kind of wounds or irritation of the tissue or anything like that. Next thing we're going to do is a sensation test. So what this is basically I'm going to ask you, can you feel this? And you tell me yes or no. Okay? And then your eyes are going to be closed for this. Is that okay? Mm-hmm. So go ahead and close your eyes for me. All right. Can you feel this? Mm-hmm. Can you feel that? Mm-hmm. Can you feel this? Mm-hmm. Can you feel this? Mm-hmm. Can you feel this? Mm-hmm. Can you feel that? Mm-hmm. Can you feel this? Mm-hmm. All right. You can go ahead and open them. So based on my assessment and review of your chart, doesn't appear to be any contraindications for treatment today. So what I had in mind is actually going to be ultrasound. Now what this is going to hopefully do is decrease some of that swelling and discomfort that you've been experiencing in the elbow region. Is this something you'd like to try today? Mm-hmm. So first things first, we want to confirm the area that we're going to be working on today. So this is going to be the common extensor tendon. So what I'm going to do here is actually have you lift your wrist up and then wiggle your fingers for me. So we're going to be right in here around the lateral epicondyle region, and we want to make sure we stay off the bone as much as possible, so you can go ahead and relax. So I did mark here already, but it's about size no more than 4 times greater than the ultrasound head we're going to be using today. So you can go ahead and relax there. Her arm looks like a good setup here. Next thing we want to do is go ahead and prop the right arm up just so you can relax a little bit here. Are you comfortable like that? Mm-hmm. And then this is actually going to go behind your back. And then I'm going to have you sit up nice and tall for me. Are you comfortable there? Mm-hmm. Great. So next thing, setting up this ultrasound machine. First thing we want to take a look at are the parameters for the ultrasound head itself. So the max BNR being 6.0. The total treatment size ERA of the head is going to be 2 centimeters squared, so that's just the size of the treatment head here. And then with the machine today, what we want to do is it's actually already set up to 3 megahertz. So we're doing that since it's a more superficial tissue, and then we want to turn it to non-thermal since she is in the acute stage, and we're going to go pulsed at 20%. And then based on that BNR, we're going to start her out at about 0.5 for the power intensity for this, and then treatment time is already set to 5 minutes, so we're going to keep her right at 5 minutes for this treatment. And so we have the machine set up. Basically what you're going to feel with this is you really shouldn't feel much of anything at all. We're going to apply some treatment gel to the area here, and then we're going to do just 5 minutes of applying that gel in there, and really you shouldn't feel much of anything at all. If you do, please let me know. Okay? Are you okay to proceed? Mm-hmm. Okay. So, I want to make sure we don't get any bubbles in this gel. And then, that's okay. I want to make sure we have the ultrasound head on before we start it. Let me go ahead and start. Any change in symptom? Mm-hmm. Okay. And we are trying to move at about 4 centimeters per second here. All right, so our 5 minutes are up there. Go ahead and wipe this off. And then we do want to assess the skin afterwards. It does look okay. No irritation, anything like that. No change in symptoms during treatment. Okay, and that concludes my treatment.